Good afternoon. Welcome to day 4 of our Miles for Melanoma Memphis virtual week-long event. If you've been to a Miles for Melanoma Memphis event previously, you would have seen our dedicated partners at Memphis Dermatology in Shelby Farms Park, providing the Memphis community with complimentary skin screening and prevention tips on site. Unfortunately, the event is virtual once again, but our amazing local sponsors at Memphis Dermatology want to make sure that the Memphis community continues to stay educated. So we are thrilled to have Memphis Dermatology's Dr. Joseph Petrangelo here to conduct a presentation about how to do a self-skin check at home and the importance of seeing a dermatologist each year. Please join me in welcoming Memphis Dermatology's Dr. Petrangelo.
Here comes the sun, doo-doo-doo-doo. Here comes the sun, and I say it's alright. Little darling, your smiles are returning to the faces. Little darling, it seems like it since it's been here. Here comes the sun. Here comes the sun. Here comes the sun. It's all right. Wait, hang on. Don't disconnect. I want to reassure you with my white coat, I am a dermatologist. I am not a reject from The Voice, although I could be. And I promise a segue is forthcoming from song to presentation, spurious though it might be, it is forthcoming. But before that, an introduction. My name is Joseph Petrangelo. I'm a dermatologist at Memphis Dermatology Clinic. And I'm thrilled again this year to be working with the Melanoma Research Foundation and helping out with Miles for Melanoma with an information session on melanoma. And so here it goes. Here Comes the Sun, wonderful Beatles song recorded in 1969, timeless, written by George Harrison. But it's a little known fact that Harrison's original title was Here Comes the Sun, It's All Right, provided that you're aware of some common misconceptions about melanoma. Crazy, who knew? But that is the original title of the song. They say Yoko didn't like it, so they shortened it. But be that as it may, let's pay homage to that original title and discuss some common misconceptions about melanoma. That's the title for today's presentation. And this is really based on things that I hear from patients. And so, I think it's a good opportunity to discuss some things that I hear as they pertain to different categories. So appearance, for example, misconceptions about appearance. There's some misconceptions out there about risk factors for melanoma. There's some misconceptions about sunscreen. And then there's also some misconceptions about tanning bed use. And so I wanted to kind of start with these and then maybe just discuss about kind of what to do next or what you can do as someone concerned about melanoma. So we'll kick right off with appearance. So next slide, please. So one thing I hear from patients is, hey doc, this spot is not raised, and so therefore it can't be melanoma. Something else I hear, hey doc, this spot is raised, and therefore it has to be melanoma. And then lastly, I'll hear kind of a combination of things. My old dermatologist told me this was fine 12 years ago, so it can't be melanoma, or a variation on the theme. I've had this spot all my life. It can't be melanoma. So let's talk about each one of these. Next slide, please. So, hey doc, this spot is flat. It can't be melanoma. Well, melanoma can be flat. These are two examples of melanoma. These are called superficial spreading melanomas, and these may at some point in the future become raised. Hopefully we see them before they're raised and get them taken care of. But just to dispel a misconception, melanoma need not be raised in order to be melanoma, as these two examples show. So superficial spreading melanoma, typically flat. And we'll talk about some of the features of these in a couple of slides that might alert you to the fact that they're a little bit suspicious. Next slide, please. So the other thing sometimes people will say is, hey, it's raised, so it must be bad. This is a perfectly benign mole. A benign nevus is the technical name. This is not melanoma. It is raised. Again, we'll talk about some of the features that would maybe alert you that this isn't something to be terribly worried about right now. But this is a benign intradermal melanocytic
nevus. Now, raised can be bad sometimes, but in this case, raised is not a problem. Next one, please. So this is an important one. I tell patients a lot, look, whatever someone told you 10 years ago, or the fact that you've had it all your life, your visit with the dermatologist is a snapshot. It's a moment in time for the dermatologist, and the dermatologist really needs you as a partner to monitor spots. So just because a nevus was benign appearing in 2012, for example, on this slide, you can see from 2012 to 2013, it changes a little bit. It gets a little bit darker. And then lastly, in 2017, it's really quite asymmetric in terms of its pigment and kind of unusual looking. So this is just a good slide to remember that just because a mole is okayed by your dermatologist on one particular day and time, you really need to be watching all of these, because strictly speaking, no mole is normal. They're all a collection of cells that, although we see them a lot and they kind of are a normal variant, they're not really supposed to be collected like that necessarily. So all of them have a potential to turn into something. So it's important to be able to look over time and do some self-skin exams, and we'll talk about that too. So those are some common misconceptions about appearance. We'll go on to misconceptions about risk factors. I'm sorry, we will start first with what to look for, the ABCDES of melanoma. So this is the things that you would look at in order to tell, is this something that's unusual or not? And I should tell you, they don't give subtle examples here on this slide. If you can see it, I know it's probably small for some of you, but there's an easy mnemonic to remember. Many of you are probably familiar with it. The mnemonic is A, B, C, D, and E. A stands for asymmetry. So one characteristic of a mole that you want to look for is whether it's symmetric or asymmetric. If it is asymmetric, either in 2 dimensions or 3 dimensions, if it's not a mirror image of itself, that's asymmetry. And that can be suggestive of a skin cancer, particularly melanoma. B stands for border. So typically benign moles, non-cancerous moles have a smooth round border. And in the case of melanoma, it's usually scalloped, or it can be scalloped, or it can be kind of jagged. Color is an important one. So color variation is a little bit suspicious for melanoma. Sometimes I'll see patients that have sort of a darker color in the middle and a lighter color outside, and even the color variation is symmetric. And that's reassuring, but you should get that checked out, any mole with more than one color. But not all color variation is bad. But if you look at this picture, this is very haphazardly miscolored. So there's reds and browns and grays, and there's no rhyme or reason to it. So that's a very concerning lesion next to letter C. Second to last diameter, rule of thumb, greater than 6 millimeters, which is basically the size of a pencil eraser. If it's broader than that, you might want to have a dermatologist take a look at it. And lastly, if it's evolving, which we talked about a little bit, that slide that showed 2012 to 2017, there were a lot of changes that occurred in that mole, and that's suggestive of potentially melanoma. So these are things that you can look for yourselves. These are things that dermatologists use in addition to other tools when they're evaluating a mole in the office. So ABCDE is a good rule of thumb to remember. Now we will move on to risk factors. Those of you who tuned in last year were probably trying to forget my rendition of One Love by Bob Marley that I subjected listeners to. But Bob Marley really serves as an excellent example of some of the misconceptions that people have about risk factors. Many of you probably know that Bob Marley died of melanoma. But some of the things that we see about misconceptions, I hear about melanoma, I'm young, so I cannot get melanoma. Well, Bob Marley was 36 when he died of melanoma, obviously quite young. So he's an example of, youth is not spared, unfortunately, from melanoma. Another misconception I hear about risk factors, next bullet, please, is I never burn, so I cannot get melanoma. I hear that a lot. And obviously, kind of a similar thing is I have darker skin, so I don't have to worry about melanoma. Obviously, Bob Marley is a good example to kind of react against that misconception. And then lastly, I have patients all the time that come in for a skin exam and they'll tell me, oh, my legs are never exposed to the sun, so I don't need you to look at my legs, they're fine. Bob Marley's melanoma was on his foot. So, there are times where you can get melanoma in places that may not see a lot of sun. Not just the skin either. You can have melanoma in the eye, in the mucosal surface of the mouth or other areas, and even on the bottoms of the feet, as we'll see. Next slide, please. So there are some scary statistics about melanoma and youth. So if we're going back to that first misconception, you know, I'm young, so I can't get melanoma. Well, melanoma is the #1 most diagnosed cancer among 25 to 29-year-olds in the United States. That's quite surprising. In ages 15 to 29, melanoma is the second most commonly diagnosed cancer. And melanoma is the leading cause of cancer death in women aged 25 to 30. So youth makes no difference, as these statistics suggest. Even if you're young, you really should do self-skin exams and come in for a skin check and make sure that you're aware of the moles that you have. And if they're changing, certainly come in. So misconception about youth dispelled. Let's move on to the next slide. So some misconception about whether or not, you know, if you're someone who tans or if you're someone with darker skin. This is a quotation from the American Academy of Dermatology. People of all colors, including those with brown and black skin, get skin cancer. Even if you never sunburn, you can get skin cancer. A couple of interesting and important things to realize for people with darker skin is that melanomas tend to be thicker at the time of diagnosis, which is that's a poor prognostic factor. The thicker the melanoma is, tends to be thicker at diagnosis, and there tend to be higher mortality rates in people who have darker skin, or maybe people who tan well, so to speak, because they're not noticed as quickly. So they can be thicker and more dangerous. There are significantly higher rates of melanomas in areas not exposed to the sun in people with darker skin. That can include subungual, which means under the nail, under the fingernail. It can mean on the palm and on the soles of the feet. And then lastly, people with darker skin can sometimes be more at risk for non-cutaneous melanomas, meaning melanomas that don't affect the skin. We referenced that a little bit: mucosal melanoma in the mouth, ocular melanoma in the eye. So these are all, you know, things that can affect really everybody, but don't rely simply on the fact that you have darker skin or you've always tanned and you never burn. Those are certainly protective to some extent, but they are by no means a free pass for melanoma. Next slide, please. And then lastly, you know, hey doc, I don't need a exam of my legs. They never see the sun. The bottom of the foot is not commonly exposed to the sun either. This is what's called an acral lentiginous melanoma on the bottom of the foot. And this is a very dangerous skin cancer, as all melanomas are. And just this serves to kind of illustrate the point that melanoma need not show up on dramatically sun-exposed areas. Next slide, please. So there are a lot of risk factors associated with melanoma, and I didn't want to leave us simply with you know, youth and if I tan well or not. These are some important things to consider. So but certainly people with fairer skin, people who tend to freckle, people with lighter hair, they are more at risk for melanoma, no question. If you have a family history of melanoma, you're more at risk for melanoma. Being older is a risk factor. Of course, young people, as we've seen, some incredible statistics related to youth and melanoma, but it's more likely in older patients. If you're male, that's more of a risk unless you are before the age of 50. Melanoma is a higher risk in females. If you have a weakened immune system for whatever reason, you're a transplant patient or have some other immune suppression, you have an increased risk for melanoma. If you have a lot of moles, increased risk. And if you have a lot or just several irregular moles that kind of are a little bit strange looking, that can put you at higher risk for melanoma as well. Next slide, please. So there are some misconceptions about sunscreen, and we'll talk about those. First one, hey doc, I read somewhere that sunscreens are dangerous. We'll address that one. Next, hey doc, my primary doctor says I'm low on vitamin C. I guess I shouldn't be wearing sunscreen. And then lastly, if it's cloudy out, I don't need sunscreen. And there's a lot of variations on this. Oh, I never go outside, or you know, I don't stay outside too much, or if it's cloudy out, I don't need sunscreen. These are all misconceptions about sunscreen. So the first one, hey doc, I read somewhere that sunscreens are dangerous. To kind of explain that, next slide, please. It's important to talk about just two basic differences between sunscreens. So for the longest time, there were physical sunscreens. You can think about kind of the image you might have in your mind of a lifeguard that has a nose that's covered in white, thick sunscreen. Those are physical blockers, physical blocking agents. There are two of them, zinc oxide and titanium dioxide. I recommend these a lot to patients because they are probably the best for sensitive skin. And physical sunscreens, they work like a shield. They block the sun from kind of getting on your skin. Chemical sunscreens, on the other hand, on the other side, these are much more cosmetically elegant. They rub into your skin very nicely. They don't leave that white residue that some people may not like, but they are a little bit more inclined to maybe cause some skin irritation. They work by absorbing the sun's rays. And it's important just to have these two different types in mind as we go on to the next slide and address some of the concerns recently about sunscreen. So next slide, please. Recently, there has been a lot of talk about, well, do I absorb the sunscreen and is that bad for me? The FDA has identified 2 ingredients that they have said they think are probably unsafe. One is PABA and the other is toluene salicylate. Fortunately, neither of these are sold legally in the United States in sunscreens. Both of those are chemical blocking agents. There are 12 additional chemical blocking agents that the FDA is continuing to review, looking more into, after it was discovered that we absorb more of them than we thought. We don't know if that's necessarily bad. We just found that there's more in our systemic absorption in our blood level than we originally thought. And so the FDA has decided to look into that. They have not deemed them unsafe, unlike the 2 that I mentioned before, the 2 that are not sold in the United States. But these 12 are kind of under review, let's put it that way. What there is no question about are the physical blockers, the titanium and zinc. Those are regarded by the FDA to be safe to use. So if you're someone who's a little bit concerned about putting the chemical blockers on and absorbing too much, and you want to wait for the FDA to tell you a little bit more information about that, reach for the physical blocking agents to help you. And then they'll probably be better for sensitive skin as well. Next slide, please. So vitamin D, a lot of people are deficient in vitamin D, and I get a lot of people who wonder about wearing sunscreen, given the fact that they may have a vitamin D might be a little bit low. The American Academy of Dermatology, the AAD, recommends getting vitamin D from a healthy diet that includes foods naturally rich in vitamin D, foods and beverages that are fortified with vitamin D, and or vitamin D supplements or pills. It's important to kind of keep in mind vitamin D from sun exposure is very inconsistent. You know, you might get it some days, you might not. You might get it some months, you might not get it very much in other months. So it's not an ideal source of vitamin D production. And obviously it increases the risk of skin cancer, that exposure to the sun. The National Academy of Medicine's recommended dietary allowance for vitamin D was actually developed based on people not receiving any sun exposure. So they kind of, they thought, okay, what is the amount that we need to take in every day if we had 0 or minimal sun exposure? And those international unit recommendations are there. Just most people, 600 to 800 international units should be fine. Talk to your primary doctor about that if you're low in vitamin D. But there are a lot of safer ways to get vitamin D that don't involve sun exposure, and you'll be more protected from skin cancer, obviously. Next slide, please. And then lastly, doc, hey, even when it's cloudy out, so I don't need to wear sunscreen. And so I just highlighted on this slide that even on cloudy days, up to 80% of the sun's UV rays can penetrate your skin. So clouds don't, in fact, that's when you can be maybe most at risk because you're not as aware and you may not even be as hot and you may not seek shade as much. But this is just kind of in general about sunscreen. What people ask all the time, what sunscreen do you recommend? Honestly, anything that you're going to be inclined to wear. So a brand in particular, I have brands that I like, but you may not like them. So I mean it when I say, look, if there's a particular brand or a feel that you like, great. Just make sure that it has 3 things on it. SPF 30, broad spectrum, and water resistant. Those 3 things are important for a sunscreen. Nobody, including myself, applies sunscreen probably the right way. So if you go down to how to apply sunscreen, you should apply it 15 minutes before going outside. You should reapply it every 120 minutes that you're outside. And then the amount, think of a shot glass. Basically, you want to fill up a shot glass with sunscreen, and that should be the amount that you put on your body. So I'm certainly guilty of not putting on enough and not reapplying. And that's dangerous. That's dangerous behavior because it can result in sunburn and then increased risk for skin cancer. And then, of course, snow and sand and water all increase the need for sun exposure because they reflect the sun's rays. And I'm sure a lot of us have experienced that, whether it be snow skiing or going to the beach or being on a lake or whatever. You get more sun that way. Next slide, please. Lastly, misconceptions about tanning beds. I think just there's one colossal misconception about tanning beds, and that just is the fact that they exist. Tanning beds are extremely dangerous. And I put this stat up here just by itself. Even one indoor tanning session, one time, can increase the user's risk for developing melanoma by 20%. That's a dramatic piece of information. It can increase other skin cancer risk as well, squamous cell carcinoma and basal cell carcinoma, but that's just one exposure. Next slide, there's a couple of other frightening statistics there. Using tanning beds before the age of 35 can increase your chances of developing melanoma by 59%, and that risk goes up with each subsequent use. Next, women younger than 30 are 6 times more likely to develop melanoma if they have been to a tanning bed. And then lastly, research demonstrates that even people who do not burn after being in an indoor tanning bed or sun exposure, as we referenced before, are at an increased risk for melanoma if they tan indoors. So these are some sobering facts about tanning beds, and it's, it would make a lot of sense to avoid it. There was a time when I practiced, and I used to say, look, you're an adult, you know that smoking is bad for you. My role is to tell you that going to a tanning bed is bad for you, and you can make a decision. It's risky behavior. But these are really very dramatic statistics. I mean, I don't know that one cigarette isn't going to likely increase your risk of developing lung cancer by 20%. Not that I'm advocating smoking, but one tanning bed use can do that. So I don't think it's quite an equivalent analogy that I was making. I think tanning beds are probably quite a bit more dangerous, and I would certainly recommend people avoid them. I would recommend my own children avoid them completely. Next slide. So, this is a lot of doom and gloom a little bit. So, you say, well, doc, I've already been to a tanning bed. What now? Or, I spent a lot of time outside in my youth. What can I do? I've gotten sunburns before. The reality is everybody's like that in some way or another. And so let me offer some real reassurance. If melanoma is caught early, if it's very thin and caught early, it is highly treatable. Most often just with an in-office procedure in our office with local anesthetic and nothing else, it can take 25 minutes and it's gone. It can be quite dangerous, and if it gets further along, it can be obviously a very deadly skin cancer. But one thing to kind of maybe offer some hope and some reassurance about maybe people who have spent some time in the sun, spent some time in a tanning bed, is that if you do some regular examinations at home and you come in for a skin check regularly, then that's something that we can fix. We can find melanoma early and treat it. So what can you do? You can do sun protection for sure, as we've talked about, which includes not just sunscreen, but also sun protective clothing. I use a lot of that for my kids because it's annoying to put on the sunscreen, or just sun avoidance in general. Self-skin exams, and we have a slide, we won't go to it quite yet, but a slide next talking about self-skin exams, which is just what it sounds like. You take your ABCDES of melanoma, and you take a mirror and a big mirror, handheld mirror and a big mirror, and you look everywhere and identify all your moles. And if any of them fail the ABCDES of melanoma, then you make an appointment and you come in and have a dermatologist look at it. And so that would be a regular office visit for, yearly visits, or for any new or changing moles you'd want to come in to see us. Next slide, please. This is just a little screening exam handout that's on the Melanoma Research Foundation website. And it just gives you an idea of, places that you want to look. Look under your feet. We saw that picture of the acral lentiginous melanoma. Look in your private area. Look under your nails. Look everywhere that you can, get your skin on. If you can't see your back, have a friend or a spouse or whomever look at your back too, and make sure that there's nothing back there. So really important. And the American Academy of Dermatology would recommend doing this once a month, which is really regular, just getting totally undressed, looking at yourself all over. And so that would be a good way to start your surveillance for potentially dangerous skin cancer. Next slide, please. We are open at Memphis Dermatology Clinic for in-person and virtual office visits. Truth be told, the virtual office visit is not the easiest in which to perform a full body skin exam. Most of the virtual visits that we're doing now are, acne and eczema and that sort of thing. But certainly if you can't get out and you want us to look at a mole, that's something we can do virtually. But we are open in person. We're eager to see you for a skin check. We still have precautions in place related to the coronavirus. We also have a new location in East Memphis, 795 Ridge Lake Boulevard. So to schedule, please call. You can see our number down there, 726-6655, and memphisdermatology.com. So thanks again to Melanoma Research Foundation and to Miles for Melanoma. And I'm really happy to be here and to be offering some insight and some music too. So thank you very much. I appreciate your time.